Now to a 12 News exclusive. The COVID case numbers reported every day tell their own story, and sometimes when it's just numbers, it's easy to downplay what's really going on behind hospital walls. 12 News' Anna Farish spoke with 3 people who work on the front lines at Ummc. She joins us tonight to share their story. Anna?
Well, hospital workers across the country are overworked, tired, emotionally and mentally exhausted, and we can honestly never begin to know what they go through each and every day that they step foot inside the hospital. 3 people I talked to who work within UMMC's emergency department say it's hard to keep going and keeping morale up when there's so much devastation around them. Say a picture's worth 1,000 words. This one showing the reality and overwhelming emotions our healthcare workers who day in and day out fight in the battle against COVID-19.
It's very tiring. It's physically exhausting.
Hilton Ram, Lydia McKee, and Leanna Crime say hundreds of patients come into the ER every day, waiting upwards of 13 to 20 hours just to be seen.
I walk through our ER right now with an intensive care unit. We've experienced a lot of staffing issues between nurses getting sick and nurses having to leave for various reasons, which has left us to have an unsafe nurse-to-patient ratio with these ICU holds.
Crime says it's hard to feel appreciated. Looking around at all of the hurt and pain, she wonders if there's really an end in sight.
This isn't a profession that you just go to work and you go home. You take it with you. You take all of the deaths, all of the tragedy, all of the sickness. You take that home with you. And I think that it's weighed on us a lot as far as our physical, mental, emotional. There's times when I go in the med room and I cry because that's somewhere I can go where nobody will see me and I can just have a moment to myself. And I think that's the picture you saw. We often go in the med room and that's just our time to unwind, to take just a few seconds that we have. But I feel like here recently we've tried to never let anyone do that alone. If you have a hard patient and you've had a hard loss, like, we want to be there with you and we want to mourn that with you.
The 3 say the harsh reality is people don't understand just how real this fight is, but they hope everyone will do their part to put an end to this virus. Now, to help with encouragement around the ER, McKee and a few other nurses have set up secret pals for nurses to have a little happy each day to let someone know that they're being thought of and there's someone in their corner. For 12 News, I'm Anna Farish.